Hey y'all, it's us again. We are here with the Everything Medical Podcast. I'm your host, Brent, and I'm a nurse. I'm joined by two other lovely nurses today. We have Eden and Lindsay. Say hi, guys.
Hi, guys.
Hello.
Thanks for having us, Brent.
So today we're going to be talking about hyperthyroidism. This is a very, very interesting topic. It affects a lot of people. And so we are actually very, very fortunate to have their expertise here with us. They are both very knowledgeable in the realm of hyperthyroidism and everything thyroid related in general. So thanks for being here. Thanks for joining us, guys.
And I heard a little later we're going to hear from your why is that so hotline, some listener questions too, right?
That's correct.
Excellent.
We are indeed. So let's just go ahead and jump right into it. What specifically about hyperthyroidism are we going to be focusing on today?
Sure. We're just going to do a general overview, right? So we're going to look at what is it, what are the signs and symptoms one might recognize, kind of what is the pathophysiology involved, a little bit about treatment, and then we'll do those listener questions you said had coming in.
Okay, awesome. So I'm assuming that, if you suspect that you have hyperthyroidism, the first thing you're going to go do is see your physician, right?
Absolutely.
Okay,
yes.
so what are they gonna do? They're gonna do some sort of assessment. They're gonna kind of take a look at you. What are they gonna be doing in that time? What does
Absolutely.
that look like?
Well, here, let's start with what is hyperthyroidism, right?
Okay.
Do you, Brent, know where your thyroid is?
I don't.
Will you model for me?
Do we have? Okay, so we have a model here. It almost. This model doesn't have a neck. We're not going to use this model.
Okay.
This model doesn't have a neck. I've got a neck.
You've got a neck.
So is the thyroid? If this had a neck, it'd be like right here.
So actually, what I'm going to have you hold it in front of your neck because the thyroid is a little butterfly-shaped tissue, little butterfly, right? That sits on the front of your neck there. And so when you went to the physician, they would palpate this thing, feeling for inflammation. This one's a little inflamed.
Just a little bit.
A little bit, yeah. Inflammation, any growths there. Causing an excess release of thyroid hormone, right? Hyperthyroidism, that's what hyperthyroidism is. You're gonna have an excess release of thyroid hormone.
Okay.
Yep, the excess relief is the circulating thyroid hormone called thyroxine and also called T4, so you don't have to say that big long word. And it affects all the body systems and it makes everything high and hot. So it exaggerates everything, your metabolism. So a lot of time you'll see rapid heartbeat, rapid weight loss. Everything is high and hot. And I have a visual I brought along with me so we can see where the T3 is and the T4. And then it gets stimulated by the TSH or the pituitary gland. And that releases that T3 and T4 and in excessive amounts.
So it sounds like this can actually be kind of dangerous, right? It actually
Yes.
sounds like maybe this is something that the thyroid has a lot of control over a lot of different parts of the body. So, so it definitely sounds like I've heard people use, thyrotoxic crisis and thyroid storm. Is that true? Is that kind of what happens when this goes wrong? A lot of other things go wrong as well.
Mm-hmm, absolutely. Okay. Hormones in the body are kind of another way. It's like your sympathetic nervous system almost, right? So you have electrical stimulations happening in one system of your body. Your hormones do a lot of the same roles, except by releasing chemicals that can carry out any wide array of effects. So your thyroid storms, your extra super amount of thyroid, can be characterized by super rapid heart rates, fever, diarrhea, vomiting, fainting, unconsciousness, some like really acute stuff. So it's definitely super important in having these things regulated.
Okay.
Absolutely.
Right. I totally see how that could be something to totally watch out for. It sounds like there's just an overall cascading effect if things go wrong.
Exactly
here.
that. Yeah.
So we do have, while the podcast has been going, we've had some people kind of type in some questions and things that they have for you guys. Are you guys ready to field a question or two?
Absolutely.
Sure.
Ready?
Okay.
Yeah. Cool.
All right. So our first question is: if I had undiagnosed hyperthyroidism and I went in for a checkup, what might the provider find? So we talked about that assessment that you would go in to you see provider, they do their assessment. What are they actually looking for? What are some of their things that they're actually going to find if you have hyperthyroidism?
So if you go in and get a general physical, then they'll do a head to toe. And if your chief complaint would be, hey, these are my symptoms. And so they could kind of do a focus assessment on your thyroid, and they would palpate it and they could listen to it and compare it to what they found before in your previous visits in their documentation. And they would, you know, if they did find some abnormalities compared to what you had before, they can definitely get some further lab work done or imaging, depending on what they find, and to help them get to the bottom of what you went in there for.
Absolutely. So with hyperthyroidism, the specific things they're going to look for in their head to toe, starting head to toe, moving down, you will find Graves' disease. That's the most common form of hyperthyroidism.
Okay.
It specifically is characterized by swelling of the eyes and around the eyes. So you kind of can't miss it. It's these like, it's called, some people refer to it as grape eyeballs, right? So it looks like they're about to come out of your face due to hormone imbalances. Moving down, like we talked about before, they're going to palpate your thyroid gland. We're feeling for general swelling or specific nodules that can be felt. They can be so swollen, hopefully that a patient would notice, but they can be so swollen that they would maybe occlude blood flow to your brain. So you've got some major arteries there, some major vasculature. They can affect hearing, speaking and breathing if super duper acute, but I don't think generally people come in so late. Moving down, some people have an immediately noticeable goiter. That's like a golf ball sized mass on their throat, and that's generally associated with hyperthyroidism as well. We talked about an increased heart rate, heart palpitation, so the rhythms are irregular. We may find, moving all the way down, thyroid cascades will also affect your legs. There's something called thyroid dermopathy, which is, it kind of looks like peripheral edema, if your listeners are familiar with that, but just swelling, scaling, kind of awful looking rash over your tibial area on your shins. Yeah.
The tibial area is the shin bone, right?
Yep.
So that's the tibia bone.
Below your knees.
Your shin bone is your tibia. So that's something to look out for. Just rash, scaly skin on the shin bone itself. Okay, so we've kind of gone over some physical signs and symptoms, what the provider is going to assess for, and what it kind of feels like. But what causes this condition? What are some of the maybe some risk factors or some different things, different variables that can cause somebody to have hyperthyroidism?
So one of the poster child for hyperthyroidism is Graves' disease. And it's the most common disease when you have the excess thyroid production. And it's when the antibodies bind to the receptors on the surface of the thyroid gland, and there's an overproduction of the thyroid gland, which again, that causes the big bulging eyes or the grape eyes. It can cause double vision, light sensitivity, dry eyes, red eye pain, and it can cause not just eye issues, but like sweating, like you're hyper and hot. So sweating, so diaphoresis and tremors. There's some risk factors that you can't change, like being Caucasian and being in the age of 40 to 80. And if you're a female, like you can't change those things. So sorry, ladies, about that. But yeah, then there's, you can have it just if you're pregnant. You can get hyperthyroidism with all the hormones going on in your body being pregnant. And hopefully it will resolve itself after your pregnancy.
Okay, so this isn't necessarily is hyperthyroidism, is it a permanent thing or is it not a permanent thing? I guess it kind of depends on the. It does. Okay.
Yeah, it can be either, right? So we have our more acute forms. Your thyroiditis is one of them. That's going to be just, it got inflamed, it got infected, and so symptoms associated with hyperthyroidism and infection will go away when that thing takes a normal size again. Pregnancy, you release gonadotropin hormone, which can stimulate your thyroid just for funsies, sometimes not.
Because you and I have actually talked about gestational diabetes before on the podcast, and so this is kind of, you can get gestational hyperthyroidism.
Exactly.
Okay.
Correct.
Gotcha.
Yes.
Okay.
Yeah.
So kind of depending on what causes it and what's going on, it may come and go, or it may be there to stay.
Yes.
Yeah.
Yes. It might resolve itself after your pregnancy. It could take a couple months to get it back to normal because after pregnancy, your hormones are still going crazy and getting rid of all the pregnancy hormones. So it could take a little bit longer, but it wouldn't be lifetime. It would get under control for sure.
Gotcha.
Sure.
Gotcha. Okay.
Kind of like just like we talked about gestational diabetes, that you just have it during the pregnancy, and typically afterwards it might take a little bit of time to get out, but then it just resumes back to normal.
Sure.
Yep.
So it just depends on the person.
A common misconception is that iodine deficiency is associated with hyperthyroidism. It's associated with hypothyroidism, actually. So that's an important thing that people often ask, what can I do to my diet to kind of change this? We advise people to watch out for like caffeine, right? Because your heart rate's going so fast already, you're processing calories already. They're going to need to eat kind of more frequent, higher calorie meals to address these metabolic needs associated with hyperthyroidism, assuming it's not treated and not under control.
Okay.
Yep.
All right. So we actually do have another question coming in that one of our listeners has gone ahead and typed out. This is from a 56-year-old individual. They said, I'm 56 and I'll admit I'm a little more sedentary than I'd like to be. I live in a pretty hot part of the country. Now I have a history of some masses on my thyroid. My doctor said they were harmless. A little while ago, my sister, who is 4 years younger than me, who had some similar bumps, said she was diagnosed with Graves' disease. Mostly I'm concerned because she also has a history of endometrial cancer, and I have started to feel some more lower back pain lately. So my question for you guys is this. Do any of these things sound like they would increase my chances of getting hyperthyroid disease?
Absolutely. Great question. A lot of good info there. Let's break it down a little bit. Some of that sounds like it would pique our interest in terms of providership. Some of it sounds like it's a problem, but possibly not related to hyperthyroidism. So one of the primary factors that we kind of talked about before, this person is within the 40 to 60 age group. I think you mentioned she was a female. And so these are hot targets for hyperthyroidism development. Additionally, it sounds like she also has a family history of Graves. That's going to be a big red flag for us there. And then she said she and her sister both had these nodules. It wasn't a problem for her in the past, but it was a problem for her sister. People can have a history of having nodules that were fine throughout their youth and younger adulthood that become consequential in hyperthyroidism later. So that's definitely true for her. Things like, climate, family history of endometrial cancer, definitely alarming for other reasons, but not necessarily linked to hyperthyroidism. And back pain. I'm sorry, you have back pain. That sucks. But not a finding with hyperthyroidism. So definitely a caveat here that, we're a medical education podcast, but we're not a medical advice podcast. If we were to give you any advice whatsoever that was safe, we would say time to go see your PCP, especially if you're concerned, and they can go get some blood work done.
Stands for primary care provider.
That's it, yes. Go see them, pay a visit, at least your annual visit, and they'll run your blood work, get our TSH levels, our T3, T4, look at our balance there. It'll help us determine whether you have hyperthyroidism, and if you do, what the source is, right? It could be primary at the level of the thyroid. It could be secondary because of other endocrine organs that are malfunctioning.
Yep.
Right.
And depending on the workup, it will show information whether someone needs treatment and what course of treatment they need, and what is the best anti-thyroid medication or iodine therapy, or sometimes you even have to have your thyroid removed, and then they would put you on a lifelong drug because it needs to be replaced since they've taken it out. So
Levothyroxine.
yes.
Yeah. So therapy and surgery kind of depends on the case. It depends on the person. It depends on what's going on. And if you have some of it or all of it removed, you would need supplemental therapy.
Exactly.
For that.
Because then you
So
don't
to
have
kind of
any
replace
left.
some of the. Okay.
Yes.
All right. Interesting. Well, that's fascinating, you guys. Thank you so much for coming on today and just hanging out with us. It's so good to talk to you guys again.
You as well.
You've been on the
Thank
podcast
you.
before, but this has been a blast. So,
Yeah, for sure.
and thank you to all of our listeners on the other end. We appreciate you guys. Thanks for joining us. Yet once again, this is the Everything Podcast signing off.
Bye,
See you guys.
guys.